Hello, I'm Professor Arif Türkmen. As you know, I'm a consultant, a plastic reconstructive and aesthetic surgeon, and also I'm a maxillofacial surgeon as well. I do plastic surgery operation as well as maxillofacial operation. What we do in maxillofacial surgery, if there's any functional and cosmetic problem, we try to sort out. Well, what are the main problems? Either can be congenital or development or trauma or tumor. So first of all, we analyze what patient's problems are and then make just basically the plan of the and treatment. And when we do that one, we do multidisciplinary approach. As I told you, patient may get to the congenital problem, just a cleft palate and lip, or macrosomia basically, or asymmetry, face. If there is any cleft and palate problem, we do mostly 3 to 18 years old patients. And if there is any development problem, like the biting, chewing, speaking problems, and then we try to sort out the problem. Most of actual development problems cause either asymmetry or biting or occlusion problem, which called the malocclusions. Can be treated by just orthodontic treatment or with orthodontic treatment and also surgical treatment as well. If there is any trauma, whatever, fracture, maxillar trauma and low jaw trauma, we call the mandibular trauma, and then we try to reposition all the fractures and fix with plate and screwing as well. And then if there's any cancer, sometimes we remove it and then all the cancer, and then we do new reconstruction tissue on the flap, like the fibula, soft tissue, ALT flap, and whatever. We try to tailor the treatment plan according to the patient's problem. For example, orthognathic surgery, it's called a double jaw surgery, basically making good balance on the face and then making a good occlusion plan, biting as well. So how can we do? We call it left foot operation, can be upper left foot, a single left foot one, and then mandible split osteotomy. Well, we just split the mandible actually, and then reposition to the mandible backward, forward, and rotate it, and then fix with basically plate and screw. And trauma, if there is any fracture line, reposition it and then fix it with plate and screw. And then after removing sometimes tumor, we have to do a new mandibular or maxilla. Mostly what we do, we take the fibula from the leg and then reshape this a single straight actually bone to the and jaw shape, whatever we need it, and then fix it with plate and screw as well. So in summary, I would like to say basically function comes actually first, then appearance, but we try to the end appearance and function together. When we do orthognathic surgery, patients stay in hospital 1 or 2 nights, and then 7 to 10 days slight swelling. After that, they can go to the work easily. But when we do like a big operation, patient has to stay in hospital 7 to 10 days, and then usually they go to the and they work 6 to 8 weeks later. If you have any problem about maxillofacial problem, we are actually quite happy to answer it. We would like to see you in our clinic. Best wishes. Happy lovely day.